Hello everyone, welcome to the FRAS Focus Regional Anesthesia series. I am Dr. Gopal Krishan jalwal, Assistant Professor in Anesthesia Department. Today I will demonstrate how to perform the USG guided caudal block in pediatric patients. Indications of caudal block. These are the few indications of caudal block: inguinal hernia repair, hydrosis, circumcision, rectal surgery, rectoscopy, coloscopy, cystoscopy, and few abdominal surgeries and lower extremities surgeries. Anatomy of caudal block. Here we will discuss the anatomy relevant to the caudal block. This is the ventral aspect of the sacrum and this is the dorsal aspect of the sacrum. Sacrum is made by the fusion of S1, S2, S3, S4 and S5 vertebra. Okay, lamina of S5 vertebra usually do not meet with each others. So there is a gap that is called sacral hiatus, and this sacral hiatus is covered by the sacrococcygeal membrane. In the caudal block, we have to puncture the sacrococcygeal membrane, and below that we have to deposit the local anesthetic into the sacral canal. The sacral canal is formed by the dorsal and ventral plate of the sacrum. When you place your high frequency linear probe at the level of the sacral hiatus in a short axis view, then you will see a frog eye like structure, and in the frog eye sign, frog eye represent the sacral cornu, and in between the sacral cornu you can see a hyperechoic line, that is sacrococcygeal ligament, and below the sacrococcygeal ligament there is another hyperechoic line, that is floor of the sacrum, and in between the sacrococcygeal ligament and floor of the sacrum, that space is sacral hiatus. You have seen the short axis view. Now when you will place your high frequency probe in the long axis at the level of the sacral hiatus, you will see this picture on the screen, and here this is the a hyperquick line, that is the sacrococcygeal ligament, and in continuation of the sacrococcygeal ligament there is another hyperquick line, that is the dorsal plate of the sacrum, and here you can see another hyperechoic line, that is the ventral plate of the sacrum. In between the dorsal and ventral plate of the sacrum, that space, that is called the sacral canal, and the sacral canal is the place where we have to deposit the local anesthetic. Scanning technique. First, you have to place your high frequency probe in a short axis view at the level of the coccyx, and then you have to move your probe in a cranial direction until you get a view of the frog eye sign, and then you have to rotate your probe 90 degrees to get long axis view. In the long axis view, you have to visualize the sacrococcygeal membrane. Patient position. Patient should be placed in a lateral position, and legs of the patient should be flexed over the abdomen. Technique. Now we are going to perform the USG guided caudal blow, and you can see that high frequency linear probe is placed in the long axis view, and now you can visualize the our needle that is piercing the sacrococcygeal membrane. When you puncture the sacrococcygeal membrane, you will get a feel of pop-up. That means you are in the correct place, and you have to reduce the angle of your needle and slightly advance the needle and then deposit the local anesthetic. Here you can see that anechoic local anesthetic that is going forward into the sacral canal. Now you can see needle, okay, and dose of the local anesthetic depends on the patient body weight and what is the surgery going to perform.